Hello, my name is Hui Zhang. I work in Guangzhou Women and Children Medical Center, while currently I work in National Children's Medical Center, Shanghai Children's Medical Center. My research and clinical focus is on childhood leukemia, especially for those relapsed and refractory cases. As we all know that the outcomes for the children with the AML remains lag behind than that of the children with the ALL. So the 5-year disease-free survival varying from between 33.3% to 79.5% worldwide. But the prognosis for those refractory or relapsed AML patients is very dismal. And in the past 10 or 20 years, there are several novel compounds have been developed for the patient with the relapse or refractory AML. And the evidence tell us that the prognosis for the patients with the relapse and refractory AML can be greatly enhanced if they are in the negative MRD state before they proceed to the hematopoietic stem cell transplantation. And based on this evidence and the background, we will tell that some novel therapies, if they can improve and enhance the MRD negative rate, they will help. There will be help to improve the children with the relapse or refractory AML. So the another thing that we know that the CAR T cell has been increasingly becoming novel therapy, especially for the immunotherapies for some childhood or out acute the lymphoblastic leukemia, especially for those B-cell leukemia. Currently, there are some reports that they will tell us that the CD7 CAR T can very effective for T-cell leukemia. And the events of the immunotherapy have some evidence to show that maybe there will be help in the refractory or relapsed AML. In those, we have the project we have carried out and presented in the ASCO 2021. We have selected CLL1 CAR T cells to treat 11 patients with the relapsed or refractory AMLs. So in these 11 patients, we all enroll patients for the relapsed or refractory patients. And we have divided it into two parts. One is a CLL1 single CAR T, and another one is CLL1 plus CD33 dual CAR T. And the patient number is 8 for CLL1 alone and 3 for CLL1 plus CD33 dual CAR T. And based on our in vivo and mouse in vitro data, we can tell no matter for CLL1 CAR T or CLL1 plus CD33 CAR Ts, they all are very effective in treating cells with CLL1 expression. And also they can prolong the survival of the mouse model bearing the CLL1 positive leukemic cells. When back to the patient data, we have enrolled 11 patients for this trial. This is our phase 1 and phase 2 trial. And the data have shown that they are very safe. All the patients has experienced grade 1 or 2 cytokine release syndromes, but there's no patient has been experienced ICNS. There's no neurotoxicity. In the meanwhile, we have observed that all 3 patients received anti-CL1 and CD33 dual CAR T cells. They all experienced grade 1 or 2 liver toxicity, as evidenced by the increased ALT levels from about 3 to 5-fold increase of the upper limit of normal value. However, none of the patients treating with the anti-CL1 CAR T cells has experienced the liver toxicities. Based on this safety issues, we have analyzed the efficacy data. The overall response rate, we can see the overall response rate is around 81%. And for those patients can achieve complete remission, there will be totally 72.7% can achieve complete remission after 1 month of CAR T cell infusion. So among the 8 patients achieved complete remission, 6 were complete remission with MRD negativity, and 2 were complete remission with MRD positivity. Even we can observe these very positive results, we also can record that 3 patients poorly responded to anti-CL1 based CAR T cell with 1 partial and 1 stable disease, and the other is response. So totally, the response is very good as we expect, but we still have some space to improve our works. I think currently CAR T cell would be options to those patients with relapsed or refractory AML, especially for those they have tried several novel compounds, especially for the tyrosine kinase inhibitors, for BCL2 inhibitors. If they have failed to respond to such novel compounds, I think that CAR T cells or immunotherapies, there will be a very interesting candidate or option for those patients. Thank you.